We'll discuss the axillary artery and axillary vein. Sometime you get a short note on axillary artery and its branches. So what is this axillary artery? It is the continuation of the subclavian artery. So that is important. The extent of this artery is from the outer border of the first rib, you can see, to the lower border of the teres major muscle, and it continues as the brachial artery. Now the different parts of the this axillary artery are first, second and third part. So this pectoralis minor muscle is the one who crosses the artery and divided into these three parts. So the part which is lying superior to the muscle is known as first part, the part lying behind the muscle is second part, and part lying below it or inferior to it is the third part. And after that, at the lower border of the teres major, it is known as the brachial artery. Now coming to the different relations of these different parts. First we will discuss the relations of the first part. Now this is the handmade diagram you can see. So the anterior relation starting from this portion or this side, it has skin, superficial fascia and deep fascia. Then comes the pectoralis major muscle. Then comes the clavipectoral fascia. Now this clavipectoral fascia with the cephalic vein and thoracoacromial artery and lateral pectoral nerve. So these contents they are lying in this portion. That is, which is they are just piercing this clavipectoral fascia. Now posteriorly, first and second digitations of the serratus anterior you can see. Clear? Then laterally it is the lateral and posterior cord of the brachial plexus, and medially is the axillary vein. So in the first part you can see the artery is related medially to the vein and laterally to the cords of the brachial plexus. Which cord? Lateral and posterior cord. And anteriorly it is related with the different muscles along with the fascia and skin, and posteriorly again serratus anterior is the main muscle which is lying in relation to it. That is first and second digitations. Now if we see the second part, that is which is lying behind the pectoralis minor, here you can see the anterior relation, that is skin, superficial, deep fascia, that is present, that we know. Then pectoralis major muscle, clavipectoral fascia and pectoralis minor. So these are the anterior relations. And posteriorly subscapularis muscle is coming and the posterior cord of the brachial plexus. Now at this level the posterior cord is coming in relation to the axillary artery. And laterally is the lateral cord of brachial plexus, and medially is the medial cord of brachial plexus along with the axillary vein. So in the first part, this posterior cord and lateral cord, they were lying in lateral relation to the artery, but for the second part, the posterior cord is lying behind it. Now at this level, the name of the different cords is depending upon the location of the their location in, you can say, in relation to the artery. The part of the cord which is lying behind, we call it as posterior cord. The part lying laterally, we call it as lateral cord, and part lying medially, we call it as medial cord. So this is the second part. Then coming to the third part. Now third part has skin, superficial fascia and deep fascia. Then pectoralis major muscle. Now it is lying beyond pectoralis minor. So it is not coming in relation to it now anteriorly. Then again the different branches of the brachial plexus are coming in relation to it. Posteriorly is the radial nerve, then axillary nerve and subscapularis muscle. So these three important relations. And if we see the medial relations, the axillary vein is there, then ulnar nerve. You can see the ulnar nerve. This is the ulnar nerve. This is the medial cutaneous nerve of forearm. This is the medial cutaneous nerve of arm. So these three nerves, they are related to this. That is the branches of the medial cord. Now on this side, the main is coracobrachialis muscle and musculocutaneous nerve. So these are the relations of the third part. So this is the handmade diagram. Now coming to the branches of the axillary artery. The first part is giving one branch, second is giving two branches, third is giving three branches. The first part is giving superior thoracic artery. Second part is giving lateral thoracic artery and acromiothoracic artery. This acromiothoracic is further giving these four branches: pectoral, clavicular, deltoid and acromial. Another name of the deltoid is, sometimes it is written in your books, that is humeral. Then third part is giving three branches, that is subscapular, anterior circumflex humeral and posterior circumflex humeral. This subscapular is the largest branch of axillary artery, which is giving one large branch, that is circumflex scapular artery. So these are the branches of the axillary artery. So when a question comes on the axillary artery, so you are supposed to write the different parts of the axillary artery. It is the continuation of which artery, that is subclavian artery, and after its termination at the lower part of the teres major, the name of this artery, it becomes a brachial artery. Then comes the branches of the axillary artery. Now this is a diagram showing the different branches. You can see first part, second part and third part. From this superior thoracic artery, here the two branches, that is acromiothoracic with pectoral, clavicular, deltoid and acromial branches. Then it has lateral thoracic artery, you can see. Then third part has three branches, anterior and posterior circumflex humeral and subscapular, along with the circumflex scapular branch. So these are the branches of the axillary artery. Now, if we see the clinical aspect, the axillary artery pulsations can be felt against the lower part of the lateral wall of the axilla. In order to check the bleeding from the distal part of the limb in injuries, operations or amputations, the artery can be effectively compressed against the humerus in the lower part of the lateral part of the axilla. So this is all about the axillary artery. You should know the introduction part of the axillary artery, then branches, then clinical aspect. Now, a short description of the axillary vein. It is the continuation of the basilic vein, that is important. Lie on the medial side of axillary artery, that we know from the relations. At the outer of the border of the first rib, it becomes a subclavian vein. It receives 5 out of 6 tributaries corresponding to the branches of the axillary artery and cephalic vein. Why? Because why it is just receiving 5? Because vein accompanying the branches of the thoracoacromial artery, they directly drain into cephalic vein. Lateral thoracic vein of upper limb is joined to the superficial epigastric vein of the lower limb by thoracoepigastric vein, enabling blood to return to the heart in blockage of inferior vena cava. So that is the channel which is given by the nature. So that is lateral thoracic vein of upper limb and the superficial epigastric vein of the lower limb. They are connected with each other through thoracoepigastric vein. If any blockage of the inferior vena cava happens, so that is the side channel from which the blood can flow. So this is all about axillary artery and axillary vein. This is very short lecture but very important lecture. Thank you very much.